How many of you had a doctor misdiagnose your child? More than once? More than twice?
Mitchell, when he is his genuine self, I think is a very rambunctious, funny kid. He has such a great sense of humor and he loves to make people laugh. So does Nathan. They both really get a kick out of making people laugh.
She was the happiest, sweetest little 2-year-old.
I was doing well in school, I was doing well in sports.
Hey Sandra, yeah, girl.
I was great, to the point where I even went away to university in a different province.
Super goofy, really funny.
No, thank you.
Very calm, very easy too. He's so polite, he still is, thank God.
Started showing symptoms of something being wrong around 6 years of age. Just went to bed one night. The next day it was just, something was wrong, we knew. We knew something was wrong.
One morning he woke up and came out of his bedroom and he said, "Mommy, I'm broken." And he started getting teary and I said, "What do you mean you're broken?" And he just said, "I can't speak." "Nathan, what are you doing?" That he just had a complete speech block. He would grunt and kind of grimace. You could see like veins kind of popping out the sides because he was trying so hard to make words come out of his mouth. He would spit. It was terrifying.
She started just having these insane, crazy meltdowns, just hallucinating.
She's been doing this for about an hour now.
Not being able to have clothes on her body, but desperately wanting clothes on her body, so emptying out every drawer, pulling her drawers out, emptying her closet.
Marin. Oh my God.
I saw him walking in circles and humming and doing this really kind of complex pattern walk in a circle.
Started to have an obsession with germs and being clean. And even when I'd say, "But you just washed your hands, you're clean," he would say, "I know I'm clean, but I don't feel clean."
But like
and that's
frustrated,
the difference.
like screaming.
It just got worse and worse and worse, and he went from being happy and healthy and thriving to completely debilitated.
Just a complete tantrum of crying, and used to hit himself in the head with remotes or run into the wall.
My mom asked me to put on socks. I'd slam my head against doors and I'd just get so mad.
And I remember thinking, like, he must be in more pain than he's creating, because why else would he do it? Like, he's creating pain by hitting his head instead of putting socks on. The threads in the socks for him were worse than smashing his face on the ground.
Yeah, the hitting of the head, it was severe. It was really severe because you would hit it so hard and say, "Sweetie, you're going to really do some damage."
We called our children's mental health agency and said, "There's something wrong."
This is not my child.
When I took Mitchell to our family doctor at the time, she was not very helpful. She was condescending.
We were referred to infectious disease, we were referred to neurology, referred to a second pediatrician.
We had been going to doctors over and over again, hospital over and over again, and they just said nothing's wrong and I'll outgrow it.
We went to occupational therapy, looking at sensory processing. We were on a wait list to see some doctors. We ended up taking him to Emerge one night when he was in crisis.
They did a MRI. They did a CAT scan, and the doctor saying, okay, good. No holes in his brain. Let's go do a lumbar puncture. When we left that hospital, the doctors brought us into this room and said, we think he might have a degenerative brain disorder, and he might, and likely, that's, 3 to 5 years of life, and you'll slowly watch him degenerate. So we went home with that, which was really difficult.
Mitchell, what's going on, honey?
There's so many things that we had brushed off by doctors as just a phase or just anxiety or a normal part of child development.
Nobody's gonna get you. Nobody's gonna hurt you. Nobody ever wants to hurt you, honey.
There was nothing normal about things that my children were experiencing. My children were misdiagnosed at least 5 times.
Sudden Tourette's.
The sensory processing,
OCD, anxiety.
anxiety,
One was Tourette's,
possibly vision.
Sensory processing.
psychogenic seizures.
So many diagnoses, I honestly can't remember.
Where our pediatric team really went off the rails was in thinking that my children were losing function as a result of child abuse.
Until your party's over. Yeah.
I'll be 4.
That's right.
My party's over.
And they thought I was actually giving them a poison to create the symptoms, to get attention. And in fact, our local children's hospital took us, myself and my husband, to court. Yeah, for child protection services.
Do you remember this at all?
Vividly.
Yeah, can you maybe talk about your experience with this?
You can. Go ahead.
It kind of, it led to our father's suicide. So it's,
Something in my gut told me there's got to be more to this story because it just happened overnight.
We did what most of the other parents do to figure this out. They get on the internet.
But I started to kind of investigate rapid onset OCD.
Just a little bit of Googling, sudden onset OCD and things like that, and out pops PANDAS and PANS.
I guess they say 1 in 200 kids have it, and I'd never even heard of PANDAS before.
PANDAS, pediatric autoimmune neuropsychiatric disorders associated with strep infections, is a subgroup of children with childhood onset obsessive compulsive disorder.
It's a conglomeration of symptoms that happens to children with an onset from the ages around 4 to 13.
And the primary symptoms of PANDAS are psychiatric. So the child has an abrupt, just unusually dramatic and sudden onset of obsessions, of compulsions, of emotional lability where their moods are just swinging up and down without any provocation.
Nathan, what is the matter, honey?
The child has depression, sometimes suicidal depression.
It also includes some actual neurological deficits where the child may not be able to concentrate, handwriting deteriorates. The other thing with the behavioral component is for a lot of the kids, they go into these rages.
I'm angry.
About what?
Nothing, actually. I'm actually angry about nothing, and I don't know what the heck is going on right now.
They have a sudden onset of eating restrictions, sometimes because they think the food is poisoned or contaminated. sometimes because they worry that they're going to throw up or choke when they try to swallow, and sometimes because of almost an anorexia picture where the child thinks that they're too fat and they stop eating to lose weight.
I think I found the PANDAS network and their list of symptoms. I could check every single one.
The only thing he didn't have was urinary frequency, which developed this past year, but that was the only thing out of everything. He had the tics, he had the extreme OCD, he had the problems with the food.
Every single symptom, he had every single one.
The doctor looked at us and said, well, it seems to me that that could possibly be PANDAS. I'm like, what?
So I got on the phone to my doctor right away and made an appointment.
I went back to the neurologist that we'd seen in London.
You know, I thought she's going to think this is the most incredible thing like I do.
And said, have you heard of PANDAS? I think this might be what he has.
And she had never heard of it.
And he says, you're not allowed to talk about PANDAS in my office, and perhaps your son just has a touch of autism.
I left pretty deflated.
I was so mad. I was just so mad because I figured it out, right? I knew exactly what it was. It was all there.
Unfortunately, a huge percentage of kids that present have to see about 5 doctors before the condition is diagnosed, just because a lot of physicians aren't familiar with this condition.
PANDAS isn't something that a lot of doctors have learned about or been educated on, and it shows. It's incredibly frustrating.
It's been so difficult to find a doctor who's well-versed or even who knows what it is in general.
We say the word PANDAS and I spell it out for them, but a lot of them still don't recognize what it is, or if they do, there's maybe what they've heard is that it doesn't really exist. It's not acknowledged.
And he told me, you're looking for a ghost and they don't exist.
It makes me feel, judged, shut down, I guess, invalidated.
I remember speaking to a nurse who actually worked in the hospital on the psychiatric ward who, when I asked her what she knew about PANDAS, she told me that they eat bamboo.
Unless you're living it, you don't know how horrible this disease is. It's hard to believe.
I got quite frustrated with doctors, and I eventually sort of let them off the hook because I knew they were too busy. They're just too busy. They've got too many things to chase. If they had a kid with the disorder, now that would be different. That would be different.
I would say the majority of doctors right now are not comfortable in diagnosing PANDAS. This is only my thought, but I presume it's because it's not something that we have been taught about in medical school.
There's a real issue with lack of awareness about this condition. So many family doctors or pediatricians may see a child that presents with these symptoms and choose to treat them with mood stabilizing medications because they don't understand that this is a post-streptococcal encephalitis. So they're not understanding that this is an infection that's causing these symptoms in the child, and that we need to treat it as though it's an infectious disease and an inflammatory condition, not a problem with their brain chemistry.
I think the specialists are reluctant to agree that PANDAS is a real thing because they're specialists. So specialists are very blinders on type of people, and I'm grateful that they are because they know a whole lot about their area. PANDAS is a disorder that encompasses more than just one area. So there's neurology involved, there's infectious diseases involved, there's immunology involved. So it kind of covers a lot of areas, and the neurologist, and this is just a for example, might say, I don't see anything on a CAT scan or an MRI, so this isn't real. An immunologist might say, this child has no evidence of strep in their body right now, so this can't be real.
I think we were all surprised by the controversy around PANDAS, except for my boss at the time, Dr. Judy Rappaport, because she had told us when we were determining the diagnostic criteria for PANDAS, she said, leave tics out of it because that would bring in the neurologists And all neurologists think that tics are always sudden. They're not there one day and they're there the next. And that turned out to be exactly what the early criticism was. It got so bad that grant applications were being triaged if PANDAS was anywhere in there, and triage means basically thrown in the wastebasket and not even considered, because this controversial diagnosis didn't need to be researched. Families couldn't get care because if they dared to mention PANDAS, that was sort of the death sentence of any further conversation with some physicians.
Guess what we were doing here?
Yeah. We went to the allergist. I told him that we'd been to the hospital lately and Ben had been diagnosed with PANDAS. And he told me he doesn't believe in it at all. And he actually told us that if we were being treated for PANDAS, that he didn't want us in his practice anymore. We weren't invited back.
When your experts that you normally refer to don't believe in it, it's very hard for you as a community family doctor or pediatrician to then run with the ball and say, no, I'm not going to listen to you, my experts. I'm going to say this does exist and treat it. That's why those people are there in those tertiary care centers, because they are the people we refer to. Those people are very well educated, knowledgeable people who do research and know a lot, but they're not aware of PANDAS yet. So if they're saying it's controversial or they're not sure that it exists, then I think it's very hard for your general practitioner out in the community to accept it.
Through doing more reading and things online, I started to search and see if there was any Facebook groups, and that's how I found the PANDAS Ontario group.
When people reach out to our organization for help, the number one thing that they're looking for is a doctor. And they're asking us where to go for help, who can I go and see? I created PANDAS Ontario because it was a natural progression of what was happening in my life after my kids had been diagnosed with PANDAS and PANS. It just seemed like more needed to be done. We're a volunteer organization. Everybody who volunteers are parents or caregivers, friends, family who are supporting somebody with this diagnosis. We just feel that better helps us be able to connect to the people that we're trying to help.
And through there, I heard about Dr. Wilson, and we heard about Dr. Edwards. And so Dr. Edwards is a doctor in Ontario who does treat PANDAS. Our doctor did agree to give us a referral to see her, but we were told that it would be probably at least 9 months before we could get in to see her. In the meantime, we did use Dr. Wilson.
I found Dr. Wilson, Dr. Isla Wilson through them, and we had our first appointment, and it was just crazy.
Patients find me primarily through word of mouth. As you can imagine, the PANDAS community is very tight-knit, and there are a lot of Facebook groups out there.
She's truly an angel, and she's the first one who helped us to start bringing Aaron back.
I knew about this condition already through my own research, and so when they came in with anxiety and tic disorders, post-streptococcal infection, I knew that this was PANDAS, and I knew that I had to investigate it and treat it as such.
She asked all these really great questions that I'd never even thought of, and then I was giving her answers. It was just adding more and more and more to the picture.
There was no doubts in our mind that we were doing the right thing.
We'd finally found someone who knew what they were doing, and someone who listened to what I was saying. For 3 years, all I wanted was a plan, and I wanted someone to help.
So if I meet a child with a supposed diagnosis of PANDAS, most of the diagnosis will come from the history. I'm going to ask the parents what they're seeing. I'm asking them for a list of the symptoms that they're seeing. I'm asking them for the history of when it started, what's different about their child compared to what their child normally was like, and whether these things are waxing and waning associated with illnesses. It's a clinical diagnosis. We don't have a dyed-in-the-wool blood test or anything like we can do that will absolutely confirm PANDAS. With PANDAS, you have to have proof that strep was there. So ideally you want a positive throat swab or a positive anti-streptolysin titer in the blood to say strep was there when this child changed or shortly after the infection they changed. So that's one criteria.
The most common presentation that we all know of with strep infection is strep throat. However, strep may manifest in other areas of the body, such as in the digestive tract, in the nasal region and sinuses, even in the biofilms on the mouth and teeth.
The other criteria is a relatively sudden onset of changes in the child. So you're going to see sudden onset of anxiety or OCD or tics. A lot of parents can tell me the very day it happened. I sent him to school in the morning and he was fine. I picked him up after school and he was a completely different child. Or I sent them to bed at night and the next morning they were completely different. So it's a sudden onset in a documented case of strep, ideally. And then you have to have this significant OCD or significant tics, one or the other. And then the last criteria is that along with those things, you should have other things that go along with it. So you could have significant OCD and nothing else, that may not be PANDAS. Part of the difficulty in treating PANDAS is that children themselves may not have the strep infection in their second, third, or fourth flare of their PANDAS. But they could be living with someone who is getting sick frequently or is even a strep carrier.
We were wondering why. Why was he not getting better? He was not at school, he was not around anybody, so why is he not getting better? That's when we then tested our whole family, and sure enough, we find my oldest son was a strep carrier. His levels were always high.
So that means that their immune system is close enough to that bacteria that it is still reacting against it, even though it's not an active illness in their family. So yes, if you have members of your family who are strep carriers, or you have brothers and sisters who are getting sick frequently, it's harder to treat the PANDAS in those children because they're constantly in touch with the infectious trigger.
Julian, how does that affect your relationship with your older brother that you have to be separated so often?
I mean, I love my brother, but it sucks because I just really want to see him, but I can't. Like, just a couple weeks ago, he had to go to my aunt and uncle's house because he can't be around me anymore.
He will, though. It's just temporary. We're just giving you a break right now.
Just
but
so you can hear.
he'll be back. He'll be back.
When a child has PANDAS, what has happened is that the strep bacteria causes an antibody production against it. So that's how your immune system works. You create antibodies to fight and get rid of the infection in the body. So that happens, as would be expected, but the immune system doesn't turn off. The antibodies keep being produced and looking for something to fight. In the brain, the basal ganglia have a similar look to the strep bacteria. So the antibodies actually can attack the basal ganglia and cause inflammation and damage there.
The basal ganglia controls motor functions, cognitive functions, mood, and behavior. And so when that portion of the brain is inflamed, that child may have irregularities in symptoms related to that part of the brain.
And that's why we see the symptoms that we do when they get, when the basal ganglia gets disturbed. But why the antibodies particularly attack the basal ganglia, I'm not sure. Obviously, there's something on the basal ganglia that looks very similar to the strep.
In PANDAS, it is proposed that this interaction between immune system and the brain occurs at the level of these autoantibodies, which normally attack viruses and bacteria, and they attack basal ganglia in PANDAS. If this is, for example, a bacteria called Streptococcus or a strep, It also has the small peptide in its own molecule, which resembles the human peptide. The antibody can be initially raised against the bacteria. So it's going to bind, and after a while, this bacteria is going to be destroyed because it's tagged by the antibody that needs to be destroyed by the other immune cells in the body. Even after the bacteria is eradicated from the body, this antibody is lingering long enough to start recognizing the protein in the brain of the patient. Then the problem begins. All kinds of OCD-like behavior, obsessive-compulsive behaviors, or tics.
I liken it to the infection lights the match, and then the immune system pours gasoline on it, and you have the proverbial brain on fire, where you get the manifestations that we see often in pandas.
I think the hardest part about pandas is definitely the flares that you have. It's awful when something else is controlling your body and you can't help it.
My worst flare was when I was hospitalized at 14. I had a feeding tube because I was scared of choking, and had an IV in because I was severely dehydrated.
I was just angry at anybody who tried to help me. I felt like they didn't do a good enough job, that it was the end of the world.
I remember asking the same question over and over. Do I have something on my face? And I always kept rubbing it.
It didn't matter how many times we answered him. It didn't matter that his skin was becoming raw. It would bleed.
I have tics. When I watch something, I'm just I can't control it.
I was in the change room, and there's a girl, and she was pointing out my tics, and it was embarrassing because I didn't really know what I was doing, and I wasn't trying to do it.
It is the repetitive, high-pitched screaming type of episodes. I would wake up after everything kind of subsided, and I would have no memory of what just happened.
I couldn't sleep, and I was scared to go to my friends' houses.
One night, he flopped into bed finally, after whatever period of time it was, and it didn't feel right, so he got back up out. I thought, oh, I should count this. He had jumped in and out of bed 400 and something times.
Sometimes I'm paralyzed and sometimes I can move freely.
He has had some pretty major rages where he just loses all control.
At this point, it's been a full hour.
Eye rolling, eye stretching, those types of things, just constantly rolling her eyes. What other kinds, honey?
Scrunch her hands.
Do you want to tell them and describe it, or show them, or do you want me to say? Me?
Severe OCD with a lot of hand washing. His record for the most soap that he's used, I think, was 80-something centimeters. So this is a bottle that's this high, and he had used about 8 of them.
I know I'm clean, and he just finished washing his hands for literally, he'd wash his hands, go in his bedroom, and then come back 5 seconds.
And he was bleeding and raw, and I'd say, please stop. And he said, I can't, I just can't. I know I have to, I can't.
I would have a total freak out. I would say I hated everybody. I would say I wanted to kill myself. I would say, I would just feel like it was the end of the world.
It's really heartbreaking when you see a 6-year-old who's having thoughts that that life isn't worth living, they'd be better off dead. And some of the videos parents have shared with me where the child's begging to be killed because they feel so absolutely awful and completely at risk.
The fear of suicide with both of my boys is consuming. I would like to believe that my children would never do such a thing, but I have seen them in moments where they are so tormented and so out of control that there isn't anything that isn't possible.
My son has screamed many nights, "Mommy, why are you allowing me to suffer this way? Mommy, if you love me, you would take my life away. Please kill me."
I'm awake! I
Do I think that they want to actually die? No, because after they come out of that horrific moment, they say, you know, I don't want to actually die, Mummy. You know, that was PANDAS talking. And thank God that they can differentiate, but the scary part is about, you know, when they can't, when they're in that moment and they can't make that call. They can't separate themselves from the disease, from the inflammation, from the brain on fire, and it's terrifying.
I don't want to be alive. I want to die.
No, you don't.
Yeah, I do.
No, you don't.
I don't want to do this.
Do what?
I don't like this. I don't want to be in the world anymore.
Baby, please don't say that.
I basically didn't want to live through this anymore, and I just thought that would make it all go away.
What I tell parents to do if they think their child has PANDAS and I'm not able to see them right away is to do something called an ibuprofen rescue. So ibuprofen is an anti-inflammatory, and if the child takes a dose of anti-inflammatory medication and improves regarding their tics, their OCD, whatever the symptom is, then probably they have improved based on the fact that they have decreased some inflammation.
I'm not exactly sure how long it took, but that afternoon, after that one dose, he was unrecognizable to me. I had never seen him so calm.
If I'm already seeing a patient and the parents know that they see a flare coming, I ask them to start that ibuprofen rescue at home on their own. That's one thing that families can do.
When treating a child with PANDAS, I'm trying to address the underlying infection. I'm also trying to reduce inflammation in that child's brain to help control symptoms. And I'm also working to modulate their immune response so that they're less likely to have a subsequent flare or relapse.
Treatment options for PANDAS start with the antibiotics. So if I meet a child with PANDAS, the first thing I'm going to do is put them on antibiotics. Try that for between 2 and 4 weeks. See if they improve. If they do improve, probably run it a little longer to make sure it stays good, and then wean it down.
When we saw Dr. Edwards, and she said, I think this is what this is, I know this is what this is, and this is the treatment, this is what we do for it. And I'm going to start him on antibiotics.
So the initial treatment is to try to get rid of the strep in the body and then hope that the antibodies die down and any problems with the basal ganglia will go away because the antibodies went away.
Honestly, within 3 days, like, the turnaround was amazing. All that time for a medicine that's available and affordable.
So if we knew that child had had exposure to or previous streptococcal infection, then I would be choosing a medication that would target that infection. If there's a chance that that child has had exposure to another type of trigger, in addition to strep bacteria, such as Mycoplasma pneumonia, for example, I might pick an antibiotic that would work well for both of those infections. It's also important to choose an antibiotic based on the child's age, size, any other medications they may be on that may interact with that antibiotic, as well as allergic reactions.
The problem is, if there's inflammatory changes on the basal ganglia, sometimes that's not enough.
We don't know what or if there is a quote-unquote permanent treatment. Again, I think each individual case is different. Each individual response to treatment is different.
Even though the stories are the same, the symptoms all sound the same, but what works for one doesn't work for the other.
We went through, several antibiotics and to find the right one. And of course, then later on we discovered, because all the antibiotics that we were using were not targeting this type of strep he had, which was more in the gut.
The gut-brain connection is probably the most important thing when treating a child with PANDAS. Often the strep bacteria do overgrow in the gut. That can cause inflammatory reactions, and that inflammation directly translates to inflammation in their brain as well.
Patients often come in with gut issues, and secondarily they'll have brain issues like depression or anxiety, and when we treat their gut issues, their neurologic issues get better.
I like to have that child on an anti-inflammatory diet so that we're controlling inflammation in their gut as well as in their brain.
What we have found is that strep, it has this thing it does called molecular mimicry, where it looks like our tissues. And even in the more classic strep infections, we see that. What the body then loses track of is how to find it. We have found that both toxins and food toxins disrupt the body's ability to find strep and get rid of it. So corn and gluten are big ones. These are big food toxins. So when these foods are in the body, the immune system is so confused, there's no way it's going to find strep.
They're eating foods that are going to cause inflammation in their gut, and that inflammation leads to the release of chemicals.
The gut flora that eat carbohydrates cause bad brain function, and the gut flora that eat fruits and vegetables create good brain function. So folic acid is fortified into our greens. So when you pull out gluten, gluten is a very problematic protein, for sure. But if you pull out gluten and say have like a rice bread, it's still got folic acid. So now what you have in the brain is you have all kinds of unmetabolized folic acid. And all that will do is trigger glutamate and disruption in the immune system. It's like taking an alcoholic and taking them off alcohol. They have a completely different level of function.
Less sugar, less junk food, and less gluten, because gluten has absolutely been proven to cause more inflammation in a gut if you are prone to that.
For our family's dietary intervention is probably the hardest, especially in kids who are those kids who are neurotypical or quote unquote normal, and then they wake up with PANDAS symptoms. You have kind of like a 7 to 8 year old kid who's used to their life and they're used to the food that they eat, and your family's in crisis. And so when we talk to families about putting them on a diet where you can only eat meat, vegetables, fruit, nuts, seeds, and eggs, it's very daunting.
If we're getting nowhere and we've been working on this for a couple of years, or they are extremely sick when they are sick, and the antibiotics that used to work aren't working anymore, then the next line of treatment is to go to intravenous gamma globulin, which is IVIG. And that is a infusion of antibodies. It's a blood product, so they pull antibodies out of donors' blood. They infuse that into the patient with the hope that the immune system in that patient will see these antibodies, realize there's enough in me now, and it'll shut off. So it'll stop the production of the autoantibodies that are attacking in the brain.
Okay, which one are you gonna take? Which one's next? Both at the same time?
It's a lot financially. It's more than I have. I don't have anything. It's a lot more than I have, but it's, yeah, it's totally worth it. I mean, I can't imagine not trying something that could help, that could give him long-term relief from this.
You wanna take these ones?
And are these the last?
Yeah, you can take those.
I'm gonna take.
If we can't get help in Canada, I am going to take him to the States. I've had my house looked at, I've had it appraised, I'm ready to sell my house if I need to, and I'm just trying everything I can to keep a little bit of money so that I can possibly afford some help. We're just paycheck to paycheck, and it's a big struggle. It really is a big struggle. He didn't have a official diagnosis of anything. He didn't fit into any program where he could get free support. And so a lot of the things that I've paid for, like his therapies, are all out of pocket. And so it's a lot of money.
I think there's one moment I remember, it would have been 10 years old. I was just started on gabapentin. I remember telling my mom I had no idea that you could feel like this. She was like what? I was happy.
We're 6 years, no, what are we, 5 years out from that? There's been some ups and downs, so when they're exposed to strep, they would certainly flare up, but it would only last a couple of weeks, a few weeks, and it was never as bad as it was before we knew what was happening.
I'm doing relatively well. I'm back to work. I work full-time over the summer. I'm taking summer courses to make up for what I lost. I'm trying to get back into my training.
You raced yesterday.
I raced yesterday.
Go, Sandra!
Good job! But otherwise, yeah, I'm doing fairly well.
Ashton's an awesome kid. He has so many things he's passionate about, and I think when he was sick, he lost sight of
a lot of roadblocks. You take a normal boy, and then they're gone. One day I have a best friend, and the next day you have a child who won't even hug you, touch you. And finally, he's coming back.
How on earth did I spend 8 years of my child suffering and not know about PANDAS?
PANDAS is real, right? There's no denying it, and there's no doubt in my mind that that's what Aaron has.
There are families all over this world that are living in absolute hell, that are terrified, that might be on their 8th year of not knowing what is going on with their child.
It's a shame that there's other people out there who have other diagnoses who don't even know about PANDAS, and they're probably hearing similar news to like we heard at the onset, where the neurologist told us, basically just live with it, and you don't have to live with it, you can get better.
As parents, we shouldn't have to walk into a doctor's office and be the expert. We shouldn't have to be doing the research. We shouldn't have to be tearing our hair out and, torturing ourselves trying to find out what's wrong with our children until our medical professionals start stepping up their game and start acknowledging, diagnosing, treating. It's going to be hell for everybody.
Hi everyone, I'm so excited that this night is finally here, and for the fact that our little organization has reached this point of growth where we're able to bring together these leading expert physicians and really begin this conversation on PANDAS and PANS at this level in Ontario.
There is a lot of effort being made through PANDAS Ontario and different societies on raising awareness.
Doctors are starting to come on board. We do see doctors who are willing to learn, and we just need that to spread across our country. We need everybody to get on board with this. So looking to the different medical organizations to educate their physicians and their members, and again, just working with the Ministry of Long-Term Health and Care to help us coordinate those connections.
Ballot item number 27, private member's notice of motion number 64. Mr. Bailey.
Madam Speaker, it's an honor to stand here today and discuss this important issue.
So Sarnia Lambton MPP Bob Bailey just brought a private member's motion to Queen's Park last week. And this motion was asking the Ministry of Health and Long-Term Care to create a PANDAS Advisory Council so that we can get the right people around a table discussing, what can we do? What can we do to better support the families in Ontario?
It's so important that this government of Ontario join this fight to raise awareness of PANDAS as a possible diagnosis in these situations. The Advisory Council I'm seeking your support for would ideally include a multitude of perspectives.
We're hoping that we can arrange to have the most effective disciplines to join the council.
But first and foremost, it would include parent representatives. The parents and the children who have lived these experiences must be part of the process to educate, inform, and advance our understanding of PANDAS.
We would be able to better educate our medical students. We could get that information in their hands.
I would strongly encourage each member of this legislature to set up meetings with representatives of the PANDAS Ontario in your communities. And believe me, ladies and gentlemen, they exist in every community in Ontario.
Validity of having our provincial government behind us just helps validate what we're doing, and it helps validate the work that so many people around the world are doing to help these families.
Mr. Bailey has moved private member's notice of motion number 64. Is it the pleasure of the House that the motion carry? Carried.
I believe the key to better research in PANDAS is getting way more specialists involved. And as respected specialists start to publish and talk about this, then the specialists in our communities will hear about this more and probably accept it.
I think we study different disciplines in order to be experts in the fields, but we should never, never forget about the bigger whole, that our body is the complex system comprised of many different organs and tissues, and that we have to pay careful attention to the other systems where the disease begins. I believe strongly that we need to integrate our experiences and knowledge to provide the ultimate answer to disease, origin and development.
There was an article in the Canadian Medical Association Journal. There definitely is this consensus that this condition actually exists and that it's a real entity. Hopefully the word will get out among educators and parents and physicians and pediatricians.
My ideal world in terms of PANDAS. Every teacher, every AA, every parent, every physician, everyone knows about it. It's on everyone's radar.
I never thought I'd say, it's okay, you'll get through it, we'll get better. But it does. Like, Ashton is so much better.
It is possible to lead a happy life, to, normal, quote unquote, to be successful in your own terms. It's really, there is hope, even though sometimes things may feel hopeless.
The advice I would give for a kid going through PANDAS, it will get better. You just have to give it time.
Definitely keep your hope up and keep thinking about the future when PANDAS is eventually going to go away. It's going to be amazing when I don't have PANDAS and I don't have all these tics and I don't have to do stuff that OCD tells me anymore. I can be free and I can do what I want.
I think that while I was going through PANDAS, I developed a lot of sympathy for other people that are suffering and stuff like that. So I think that my life would have been much different if I didn't get PANDAS. So
if you only treat what you are taught in medical school, then there will be no progress in medicine, because that's what medicine's all about. Things change and get different, and there's more research done, and you learn and you learn and you learn.
As a rare condition that not many people know about, including myself before I started treating it, I wanted to be able to educate the public, educate other doctors that this is something that exists, that it's worthwhile looking into and it's worthwhile treating.
I too often hear that PANDAS doesn't exist or that they don't believe in PANDAS, and I don't feel that this is something that you can believe in or not.
So if you're curious and you're reading, you will find a lot of really wonderful research out there about PANDAS.
And even if that practitioner is maybe not comfortable with diagnosing or treating that condition, I ask that they have an open mind and listen to those families, listen to what they're going through, and try to give them the help that they need, or at least direct them on to someone who will.
Never give up. Never give up on your child. And demand competent care when you're approaching healthcare providers. And that's ultimately what you want, is that you demand competent care.
I'm actually kind of glad that I got it, because then I wouldn't have been able to help so many kids.
How are you helping other kids?
I'm doing this video.
It's our hope that tonight will be a first step to highlighting for all of you how dire the need for acceptance and awareness is, but also a step in giving you the knowledge and the tools to recognize and to start to help these children that you're supporting in your practices or in your workplace in a much more meaningful way. 1 in 200 children. If this statistic holds true, then we haven't even scratched the surface in Ontario. This could mean that there could be over 11,000 children or more dealing with this in Ontario. We all have a lot of work to do.
It's really exciting to see so many people here. Like, I cannot tell you how excited I am. And I know a lot of you are parents because I recognize a lot of you. I have no financial disclosures, unfortunately, and no conflicts of interest to report. I will disclose that I am a firm believer in these conditions, PANDAS and PANS, and I think they deserve real treatment. It breaks my heart to admit that I had a patient years and years ago who came back from a vacation and totally changed, stopped eating. And she would be in her 20s now. I don't know where she is, but I'm sure she was this, and I didn't know about it, and I missed it.
Controversy has long since outlived its usefulness. It is time for it to die, as it is doing a disservice to pediatricians and to the parents.
Over the past 3 years, I have missed out on life. I know most children my age would most likely tell you they don't like school, but I love school. I love learning and socializing with my friends, but this illness had me housebound for almost a full school year. I know that I am a very lucky boy because I have a great family, awesome friends, and the best doctor. As my parents tell me, I am not alone, and I hope that in sharing my story, other children out there will feel the same. Thank you for listening to my speech.
I am one of the lucky ones to have had success with my treatment so quickly and drastically. I can only hope that more kids and parents that are suffering can find this same peace. I have now been able to spend more time painting and creating art, something that is so important for me. I believe that anyone who sees the work will directly relate to each of the stages, knowing that a lot of you are supporting someone that is suffering the same. Thank you.